Welcome, everyone. Thank you for joining us. My name is Jay Cranston, and I'm a marketing manager at Signifier Medical Technologies. We have an exciting webinar planned for tonight where you're going to discover how eXciteOSA, which is a non-invasive daytime therapy for obstructive sleep apnea, is helping patients with psychological barriers to therapy. And we have our expert of the evening, Dr. Thomas, who will be presenting. Thank you for helping us here.
Well, thank you for having me. I'm excited about this topic and something I'm passionate about. I'm a sleep psychiatrist, and yeah, I'll be talking to you about the use of eXciteOSA in the psychiatric patients.
Great. Thank you. Yeah, so just as some housekeeping, feel free to ask questions. There is a Q&A chat box at the bottom. So throughout the webinar, you can ask some questions. We will answer some of them probably right in the chat box, but for the most part, we're going to save the questions for the end for a Q&A session, maybe 10 to 15 minutes, where I will moderate and ask Dr. Thomas the questions. So yeah, don't be shy. Ask the questions in there. Again, we have our expert, Dr. Tara Thomas, who will be presenting this evening. And thank you so much for being here. And Dr. Thomas is a sleep psychiatrist at the Michael E. DeBakey VA Medical Center and an assistant professor at Baylor College of Medicine. With over 5 years of experience specializing in behavioral sleep medicine and integrative health, she brings an innovative and tailored approach to helping patients overcome sleep conditions associated with sleep apnea. Dr. Thomas is research-driven and has been involved in numerous clinical studies and publications during her career. And now we're excited to add a webinar about eXciteOSA on there. So thank you, Dr. Thomas, and take it away.
All right, let's get started. There we go. Okay. So agenda. We're going to talk about number one, an introduction to eXciteOSA. Secondly, I'd like to talk about the psychological barriers to therapy. And then thirdly, talk about eXciteOSA as we use it in the VA, which was where I work. And I'm going to go over some case studies with patients that I dealt with. And then finally, just talk about some key takeaway points. And then we'll end with the Q&A. Okay, so just an introduction. So eXciteOSA, it's a non-invasive treatment for mild obstructive sleep apnea and snoring. It's FDA authorized. So some background information, as you can see from here, on a treatment continuum, it's used to treat primary snoring and mild OSA. So that involves anything with an AHI of less than 15. We also use it, there's some data showing that it benefits moderate OSA, and I have used it in a couple of patients and a lot of my colleagues off-label, and there's still some research studies going on for moderate sleep apnea, but mainly for primary snoring and mild OSA. As you can see from here, it's also, I've used it as an adjunct for positional therapy, for an oral appliance, and then also for patients with that use CPAP therapy as an adjunct therapy. And some people they still have symptoms, they're still sleepy despite using either positional therapy, oral appliance, or even CPAP. So I do try this as an adjunct, and I've seen some good benefit. And with that, we do not recommend it with the hypoglossal nerve stimulator. So yeah, that's lastly. Okay, let's go over some of the pathophysiology of eXciteOSA. So basically, what's going on is that we have the genioglottal muscle. It's one of the largest muscles in the upper airways, and it's necessary to maintain upper airway patency. So it's very like floppy. And what happens is that the eXciteOSA, it provides a electrical stimulation that increases the endurance of this muscle because it does become fatigued, and that's when you have these apneic or obstructive events when it becomes fatigued, but it increases your endurance of that muscle. Okay, so this is how it works. So first off, what it does, like studies have shown that patients with OSA have reduced genioglottal endurance. So as you can see from here. And the eXciteOSA, how it works, it delivers this electrical stimulation, electrical current between 3 to 20 hertz. It's four-pronged, it sits on the tongue, and it's shown to increase the endurance of that, switching from the fast to slow twitch muscle fibers. And what happens is that this reduces the apneic and hypopneic episodes because there's less obstruction. Okay, so I'm going to be showing you a video, give you more details about how this works.
With the aim of improving endurance of the upper airway dilatory muscles, eXciteOSA provides a novel daytime therapy for patients with mild OSA and primary snoring. The compact device applies low-frequency neuromuscular electrical stimulation, NMES, via 4 electrodes that rest directly on the tongue, stimulating the upper airway muscles. Simple and comfortable to use, the daytime therapy requires only 20 minutes of NMES each day to increase responsiveness and prevent excessive relaxation of the tongue muscles during sleep. According to clinical research in skeletal muscle stimulation, NMES has been shown to result in a change in myofibrillar protein expression to induce a phenotype shift from fatigue-prone to fatigue-resistant fibers with the strengthening of the cytoskeleton. In summary, eXciteOSA's innovative, clinically proven daytime therapy trains the tongue and upper airway muscles to be more resilient against mild OSA and snoring.
All right. Okay, so the clinical experience. So therapy phases, there's 2 phases. You have the first phase, which the patients are using it for 20 minutes a day, once a day for 6 weeks. And it could be any time during the day. And then the second phase is they're using it twice a week or more, but it's more of a maintenance period. So this is just more of like the app and how they're talking about the different therapy phases. Okay, so this is important because this is the stimulation frequencies. I would like to say this is like a HIIT class. You know, at first you have your walking at the 3 hertz and then you're walking. And then you get like, you know, if you're doing the HIIT class, you're doing a sled, that's the more intensity, the higher intensity, which is the 10 hertz. And then you have the 20 hertz, which is when you're doing the running at the max speed. So this is just like for like the frequencies that the stimulation frequencies you'll be at throughout. Okay, so these are the stimulation levels range from 1 to 15. It's controlled in the app. And usually we look at like the tolerance and it varies with patient and we increase it over time. So at first, so the first week, you're at a lower stimulation frequency. Then as the weeks go on, you get higher. So just how much they're able to tolerate that. So these are some clinical trials. So we looked at subjective and objective data. So with the subjective, we looked at like, you know, the bed partners. Are they saying like, you know, wife or husband? Are they saying that, you know, the patient is snoring? Then we did a watch pat and we looked at the reduction in snoring. As you can see, the snoring has reduced significantly with eXciteOSA. So this is the subjective and objective report. So yeah, over 52%. Okay, so here we look at the impact of eXciteOSA on OSA severity. So they looked at all the participants with 65 participants and then responders. So there was a 78% were identified as responders, which is pretty significant. So this is like a reduction in the, there's a significant reduction in the AHI with these participants. So adverse effects. So there's no serious adverse effects with this device, but you know, things that may occur while you're using the device is, you know, you have pooling of the saliva, tongue tingling, tooth sensitivity, but this is rare and it only occurs in the setting of when you're using the device. I've never had any patients tell me specifically that they've had anything like a residual side effect while using it. So that's a benefit of this device. Okay, so I'm going to go into some of the psychological barriers to therapy. So some background. So as you can see, you've probably seen if you're a provider that OSA, a lot of these patients have psychiatric conditions, depression, PTSD, anxiety. They go hand in hand. And a lot of these patients, the OSA affects their quality of life and their adherence if they have like a psychiatric condition. So adherence and treating the sleep apnea is very important. So this is just like something that I thought would be important. That I want you to understand that the psychiatric conditions and OSA, there is they go hand in hand, and the conditions affect each other. So first you'll have where patients, they have like sleep fragmentation, they have like apneic episodes, and upper airway resistance, pauses in breathing. That leads to biological dysregulation. This leads to inflammation, stress, neurotransmitter imbalance. And then you have the CNS effects. These are the psychiatric disorders. You have this fight or flight response. Like they have like that hypothalamic pituitary axis dysregulation. This leads to anxiety, depression, and worsening symptoms. And they have the psychiatric conditions or psychiatric meds that they need, and those cause a lot of weight gain. The psychotropics, like predisposing them to metabolic syndromes such as obesity, diabetes, and cardiovascular disease. So this is just another image, and it kind of goes into how the interplay between the two. So with OSA, there's a repeated arousal, upper airway instability. A lot of these patients are CPAP intolerant just because they're struggling with PTSD. They're very like hyper aroused, checking the doors, checking the windows. They have a lot of disturbing nightmares. This causes REM dysfunction. They don't get into that REM sleep that is restorative. And then decrease in REM leads to less recall frequency, and then leads to insomnia, and then CPAP intolerance. So it's a vicious cycle of just insomnia, untreated sleep apnea, and then worsening PTSD and symptoms. So prevalence of OSA and psychiatric conditions. Roughly 67 to 83% of PTSD have OSA, and of the 23% of OSA patients have clinical depression. So one thing I want you to be aware of is that eXciteOSA, it's a good alternative to CPAP. I believe in it. I feel like I was telling Cami earlier today that this is something I'm passionate about. It's a great alternative for my patients. They struggle a lot with anxiety, claustrophobia. A lot of them are struggling with claustrophobia due to PTSD, discomfort, and this leads to not being adherent to the therapy. This is very user-friendly. They don't need an RT or anybody to help them. It's pretty straightforward in terms of setup, very user-friendly. And then another thing I wanted to mention is a lot of these patients with comorbid OSA have like poor motivation. So this is something that's easy to use, user-friendly, and patients would, be more compliant. So I want to go back into my experience with eXciteOSA in the VA. So patient selection criteria. So the main thing, indications for use, like we talked about earlier, what it does, it's a 4-prong electrode that sits on your tongue, and it provides a stimulation. So it's used to treat patients that have a mild OSA, which is AHI less than 15. It helps with patients with snoring that are older than 18. And patients that should not be using are people who are pregnant, who have a pacemaker or an implantable electrode, or this also involves the hypoglossal nerve stimulator, or that have any dental jewelry in the mouth, or have any ulcers. So these are all exclusion criteria. So patient education. The main thing is that it's very easy to use, once a day for 20 minutes for 6 weeks. And then after that, twice 2 days a week thereafter. That's a maintenance period. You start low, start with the low stimulation, then increase to tolerability over time. The main thing, just side effects, just as you're using it, tingling, teeth sensitivity, excessive saliva, but those are normal while you're doing the treatment, not long lasting. So patient setup can be done clinically or remotely, which is, it's like I said, pretty easy to do. So this is how it works. First off, you have the mouthpiece and you have the control unit and the extender cable. So you charge the unit, the control unit, and then you download the app and sign up. Then you connect the mouthpiece to the control unit, and you'll see like a blue light, and then it will connect it to your connect via Bluetooth to your phone. You insert the mouthpiece on the top of the tongue and gently close your mouth. And this basically provides that electrical stimulation that that strengthens or reduces increases the endurance of your tongue. So yeah, I would avoid any like clenching or grinding while using the mouthpiece. And then you just select the correct intensity. Main thing you want to know, like I said, the side effects, it's like you have drool, like saliva, increased saliva while using it. You want to make sure while cleaning the mouthpiece, you just thoroughly clean it with just running water. You disconnect the device and you just clean it thoroughly with water. And then, yeah, that's basically it. And, you get your data over the next couple weeks and see, it'll give you to see how you're doing. So I really want to go over some case studies. These are some patients that are testimonies to how effective eXciteOSA has been for my patients. So we have case study number 1. We have Mr. JW. He's a 37-year-old man. History of mild sleep apnea, BMI of 19.5. He has a history of PTSD, mood disorder. He's coming in. He's very excessive daytime sleepiness, irritability, and worsening anxiety. He's on medication, so these are 2 antidepressant effects. So Buspar 3 times a day, Wellbutrin 150. He's on Lunesta 3, which is a sleep aid. He got a sleep study in June, and he was found to have AHI of 14, lowest oxygen 88. So he started on CPAP therapy. Automatically, he was just having claustrophobia, panic attacks. He struggled with insomnia, just nightly nightmares. He was ripping off his mask. Compliance was down to 1 to 2 hours. So I just stopped it because I was, he's not using it. Worsening anxiety and depression and panic attacks. And insomnia. So I thought, okay, eXciteOSA is a good alternative, very non-invasive and user-friendly. After 6 weeks, he had reduced snoring episodes. He had more consolidated sleep. His mood was better. Anxiety was better. PTSD was better. So his Epworth sleepiness scale went down from 22 to 4. His PHQ-9, depression scale, went down from 22 to 3. GAD-7, which is our anxiety scale, went down to 0. And he said he's able to he travels frequently for work. He found this easier to use the device. After 6 weeks, I followed up. His AHI reduced to 70%, which is very significant. So that's one case where, he did significantly better with eXciteOSA. So we have another woman. This is case number 2, patient ZC. She's a 50-year-old woman, past medical history of obesity, hyperlipidemia, hypothyroidism, type 2 diabetes, depression, anxiety. She's coming in, she's very sleepy, fatigued, irritable, also having some hot flashes. She's on medications of metformin 100, Synthroid 25, atorvastatin 20, sertraline 200. So she's on an antidepressant and then medications for diabetes and thyroid and lipid. When she got the sleep study, her AHI is 11, her lowest oxygen was 88%. I prescribed her CPAP. She wasn't able to adopt it. She found it cumbersome. She had frequent urination episodes, hot flashes, in premenopausal, and her anxiety worse. And another thing that made her concerned is that her partner didn't find it very attractive. He said she's sleeping with a gas mask next to him. And so that was troublesome for her because, she wants to be able to sleep with her partner, and he was getting bothered by her using the CPAP. So I switched to eXciteOSA, and after I did a follow-up after 6 weeks, her snoring reduced significantly. She was more alert, more refreshed, anxiety decreased, her mood improved. She felt happier, more refreshed. Her anxiety score went down to 2, her PHQ-9 went down to 2. And then there was a reduction in her AHI after a home sleep exam to 2. So she got a lot better. So key takeaway, I want you to know that sleep apnea can affect medical conditions as well as psychiatric conditions. They go hand in hand, as you can see from that image that I showed you earlier. And psychiatric disorders are at greater risk of developing sleep apnea just because of the medications and also the disease pathology. They are more prone to sleep apnea. So there's a large overlap between the two. And this is a good alternative to CPAP because a lot of these patients that I'm dealing with are struggling with anxiety, depression, PTSD. It's very user-friendly. They're more motivated to use the device. And overall, it's been great. And I highly recommend it to everyone. And, if you're having patients that struggle with psychiatric conditions that cannot tolerate CPAP, this is a great alternative, very user-friendly, and it's been great so far, and I highly recommend it. Any questions?
Great. Thank you, Dr. Thomas. Yeah, it's really great to hear your perspective from a psychiatry background and understanding the different anxieties and mental illnesses and other things like claustrophobia that affect patients and how using something like CPAP may not work for those types of patients. So
Right.
to have something like eXciteOSA that is non-invasive, is done during the day for just 20 minutes. It's nice to hear from you and hear that you're having patients with success. So thank you so much for sharing all of your knowledge and experience. We appreciate it.
Of course.
And we do have some questions that are rolling through here. So first, what criteria would you consider most important when determining whether a patient is a good candidate for eXciteOSA?
Like I said, people who are, don't have any metal in their mouth, jewelry, don't have any implantable device, not pregnant, those are and people who can't tolerate CPAP therapy, that's another one. So those are the candidates, or not pregnant is what I mentioned that. Okay.
Okay. Would you recommend eXciteOSA as an early intervention?
I have done that as an early intervention. Obviously, the CPAP is a gold standard, so I would start with that first. But if a patient is coming in and they're already saying they have issues with claustrophobia, they cannot tolerate CPAP. They went in the in-lab study and they got CPAP and they if they weren't able to they're not going to have something on their face due to like extreme anxiety and claustrophobia. I would probably consider if they have mild sleep apnea.
Great. Have you observed benefits in managing psychiatric comorbidities through eXciteOSA treatment?
Absolutely. Their depression is better, their mood is better, their anxiety is better. There is an overlap. A lot of people with depression and anxiety, they struggle with sleep and insomnia. The underlying condition is that they have untreated sleep apnea. So you're treating their sleep, their mood is better, their anxiety is better. So it goes hand in hand.
Thank you. So you did go through a couple case studies and follow-up. So what is your typical follow-up protocol for someone using Excite?
Like I said, like it's usually like a 6-week follow-up, after they've started the device. So they work through the first phase and then the second phase, and then usually that's when I follow up after that.
Okay. Now you mentioned in-clinic setup and remote setup. I'm not sure if you're using both, but do you find patients have a higher adherence if someone's set up remotely or in the clinic, or what's your thought on that and what you prefer to do?
I mean, I think depending on the patient and how technologically savvy they are, I would say, I mean, either way is fine. Like if they're, young individual and they're like pretty tech savvy, then okay, they can do it at home. If I feel like they need more assistance and they're older or they, I would tell them to come in just so we can troubleshoot and make sure they're able to, set it up appropriately and get them squared away.
Okay. Um, do you see patients coming back after, let's say, 6 months saying that the device isn't working and symptoms are recurring? What types of questions are you asking those patients, and are you going over some progress with them?
Yeah, so I have had that happen. It's in rare cases, and I will repeat the sleep study just to see like if they have residual symptoms, and then, maybe have a discussion on, like, okay, are they using it or are they not, or alternatives. Most of the time it may be a compliance issue in that case. Or, I mean, in rare cases, we'd have to switch therapy, but that's usually the case.
Thank you. Can you talk about the effect on cortisol with sleep apnea?
Yeah, so I mean, when you're not getting sleep, when you have like these micro arousals that occur, and when in insomnia, your cortisol levels go higher, and that leads to metabolic syndrome. So it makes you insulin resistant, you gain weight, and it's like a stress hormone. So you're insulin resistant, your sugar levels are higher, and you're gaining weight.
Thank you. Um, just going through some of the other questions. So can the patient get through the physician office, or do they have to go through a DME provider? So I know Dr.
Yes,
Thomas,
yeah.
you're with the VA, but yes, if outside of the VA, it can be through the physician or through the distributor, the DME provider.
Right.
Yeah. So can we monitor this remotely or change settings for them if they call us regarding troubleshooting? Is subjective data the best way to determine the effects of this device?
I would say both. I mean, like I said, we could do a repeat sleep study, see how they're doing in addition to subjective data. But yeah, I would do both.
Okay. The questions are rolling through. How often does the mouthpiece need to be replaced? Does the VA pay for the service? We have someone within the VA on here.
Every
So
90 days.
yeah, every 90 days for the mouthpiece. And yes, it can be used as an adjunct therapy that like you talked about with a mandibular advancement device or with CPAP or positional therapy.
Mhm.
Okay. Do you screen for enlarged tonsils or tongue position or swallow function? And does this help with dysphagia or saliva in the mouth? Many patients have dry mouth from different meds.
So I mean, when you do an initial exam, you look at the melon potty and check out their tonsils. So that's already the assessment when you see a sleep patient. So um, I mean, yeah, a lot of medications can cause dry mouth, but I don't see any contraindications in that case.
Okay. Do you ask patients to use something like the Snore Lab app on the phone to help monitor their snoring while they're doing this treatment?
If it's an app, I mean, I don't ask them to use any other app outside of the eXciteOSA one. No, I do not.
Okay. So question, duration of maintenance is 2 sessions per week after treatment. Yeah, so it's a minimum of 2 days a week.
Yeah.
Is there an ideal sleep study type for this assessment?
You mean patient type? Is that what okay, any data on age related?
Ideal sleep study
So
type.
anything, so they're saying it's patients above 18,
Yeah.
and with mild OSA, they would all qualify. It's not,
Okay.
I said the exclusion criteria. So if they have mild OSA or primary snoring, and then they don't, they're, we get rid of the exclusion criteria, then yeah, those are.
Okay, so we've also got a question about 2 times per week for how long? So it's
indefinitely.
ongoing. Yeah. Okay. So yeah, we've got a couple more asking for more information. For sure, we're going to be sending a recording of this webinar out to everyone where they'll be able to gain access to different handouts, different education, also about our clinical trials, ongoing trials. We do have a double-blinded randomized control trial that came out last year, so we'll be sending that. You can have information on that if you go to our website. Um, Another question about the mouthpieces. So mouthpieces is every 90 days. Um, yeah, but it looks like, and if we didn't cover the question, someone will have done it through either the chat or we can answer some of the questions separately when we send the email as well. Okay. All right. Well, thank you very much, Dr.
Thank
Thomas,
you so much for having
for
me.
presenting today this exciting topic. And thank you everyone for joining us. We hope you were able to learn something about eXciteOSA and how it can help any patients that may have psychological barriers to therapy. And yeah, I hope everyone has a great evening.
Thank you so much and have a great evening. And I strongly suggest trying eXciteOSA for psychiatric patients.